talking about appointments, I just want to emphasize, because when I teach with Dr. Jonathan Evans, questions come up every year about whether we should charge for baby treatments. Yes, charge for your treatments. Your education is valuable. The time you take is valuable. I take time to go watch dentists do frenectomies. I take time to go learn more about what lactation consultants do. That's my time, but it makes me a better practitioner. And if you ever want to, get interested and be involved and network like that, I suggest doing that too. Reach out to those practitioners that you hear are working with babies and give them a call and tell them who you are and tell them what you're trying to get into and what you want to do, and go job shadow for half a day. And like getting back to that charging for your services, you can't run a business obviously and support yourself or your family if you don't charge. You can always keep a sliding scale for those families that are in need, right? And you want to be taken seriously as a practitioner as well. Would you ever go to the chiropractor or the doctor and they say this is free of charge? Like, not usually. Not usually. So keep that in mind and remember how valuable you are to the family and to that baby. Okay, so let's move on to the second point here. Going back to remembering like how I stay calm is to know that I only need to do a little bit to affect wonderful change. Even if you're not feeling it in that moment on the table, if you feel the slightest relaxation in the tissues that you're palpating, that's enough. More often than not, the next time those parents bring that baby back, they're going to tell you at the very least that the baby seemed more relaxed and happy. And just to give you an idea of how little of a change can affect a big change, and if you think about how many breaths a baby takes in 1 minute, which is 70, that equates to 3 million breaths in a month. So even if you unjam 3 ribs in the lower right thorax, balance tension in the clavicle on the left, you've improved the respiratory mechanisms, the capacity for that thorax and that abdomen pressure to balance out. It's quite impactful. So always trust that something's going to improve, because it will. And that brings you back down if you start to get, those doubtful moments.